Camp Methodist Mission Station is located 12 miles from Buchanan, Liberia. Since 1980, it has provided a church, clinic services, a school, and an agricultural training site to the residents of 40 nearby villages. Trinity United Methodist Church in Denver, Colorado initiated a traditional birthing assistant training program at Camp Mission. This program is under the direction of Bob Gibb. Traditional birthing assistants, or TBAs, are women who act as midwives during births in traditional villages. They have been trained by women elders in the villages and followed tribal practices used for hundreds of years. However, these practices did not follow basic sanitary and hygienic medical guidelines, and as a result, between 30 and 35% of the babies died. In addition, maternal mortality during childbirth was common. In this TBA training program, women who are already acting as midwives are trained in medical best practices to follow during births. They are also trained in pre- and postnatal care, as well as providing proper nutrition to children. In addition, each TBA is equipped with a birthing kit, which contains basic medical supplies, such as rubber gloves, scissors, gauze, and protective plastic sheets. Here, the TBA demonstrate how training takes place using role plays and discussions. These training sessions are conducted in Bassa, the traditional language spoken in the Camp Mission area. The TBAs are also given books which use illustrations to explain the best practices taught in training. TBAs usually walk from their villages to the Camp Mission for training. On this day, they were fortunate enough to get a ride. In order to get a trained TBA, each village must provide moral and financial support to the program. This support includes the construction of a birthing house, so that births don't have to take place in the mother's home. The villages must also provide a stipend for the TBAs. Villagers and TBAs are touring a birthing house that is under construction. TBAs are highly respected in their villages because they have reduced infant and maternal mortality in the villages. Here, a town chief expresses his gratitude for his TBA and the program.
We thank you ever so much because through your training, our women left and they went for the training. Since they told our training, our women have been delivered so well and nothing happened to them.
At this village, the TBAs, Bob Gibb, and his companions are honored with song and dance. This is Mary Kwokbo from Glaby, a trained TBA.
Through your help, then from that time we have learned it and we're doing well now. And nothing has ever happened since we started doing our delivery. She want to bless God ever so much for that.
Bishop John Innes, Bishop of the Liberian United Methodist Church, comments on Trinity's TBA program. His comments have been subtitled because of audio difficulties.
Since the introduction of the TBA program, through your effort, through your church's effort, great and wonderful things have happened. Lives have been transformed. Women deliver freely because of the education that your team has provided over the years. So they know how to handle new babies, to handle the environment, and have to give hope to one another. So this is a program of thanks and appreciation, and we just glorify God for the commitment of your church to the TBA program at Tampa Mission.
Trinity United Methodist Church became involved in this program as a direct result of a goal set at the 2008 Methodist General Conference to increase access to health care in third world countries. To implement this goal, 7 areas of concentration were identified, which are reducing infant and maternal mortality, sanitation, clean water, family planning, AIDS prevention, nutrition, and malaria prevention. The Trinity Project concentrated on the TBA training program, and now that program is self-sustaining. Trinity also provided this motorcycle, used to deliver immunization programs to remote villages. The Trinity Project will now concentrate on providing fresh water wells to the villages. Village water is currently obtained from nearby streams carried in pans and buckets to the village. In tropical areas, surface water contains many disease agents, which cause frequent sickness among those who consume it. Purification techniques such as boiling are cumbersome and not supported by traditional practices. A practical solution is to dig a well in the village, which would be more convenient for the villagers and would provide cleaner water for them. With the TBA program, villages are required to make a commitment to help build the well, and then maintain it. Villages must provide the rock, sand, and gravel needed to build the well. The program pays for the diggers, forms to build the cap, and the pump itself. Trinity has made a commitment to support the Liberian villages that are willing to support the TBA's and well program. As a result of this program, infant mortality has been reduced from 30% to 5%. Future plans for Trinity's Liberia Mission Project are to build latrines, provide mosquito nets, and to develop a process to have villages take total responsibility for all these programs. Longer-range plans include replication of the Camphor program in other areas of Liberia. This is a concrete example of Trinity's conviction that they are reflecting through their mission project, the teaching of Jesus that we must minister to the neediest among us.